Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Hemorrhage Control, Episode 1, Tourniquets.
Our three main objectives in the use of tourniquets are identifying life-threatening extremity hemorrhage, learning how to apply a tourniquet to an upper and lower extremity, and instruction on how to make and apply a field expedient tourniquet. Exsanguination, or life-threatening hemorrhage from an extremity, is a leading cause of mortality both in the military and civilian populations. The tourniquet has experienced a huge resurgence in the military. Current conflicts have generated large numbers of patients with extremity wounds that are alive today because of tourniquet use. With increasing violence toward law enforcement, police departments throughout the country now include tourniquets as standard duty equipment. EMTs have the option to use tourniquets as a first-line treatment. When faced with a life-threatening extremity hemorrhage, EMS personnel may apply a tourniquet to an extremity and be done with that immediate life threat. This will allow other treatment to proceed more rapidly. Time is therefore not lost holding pressure, and you now have another set of hands to assist. Rural EMS providers, by applying a tourniquet immediately, gain valuable time, allowing them to get to a hospital or rendezvous with advanced providers. The tourniquet, when applied, is designed to place circumferential pressure upon the skin, muscle, and underlying tissue. The pressure is transferred to the walls of the blood vessels, causing temporary occlusion. Larger extremities, such as the leg, will generally require more compression as compared to an upper extremity. The main indications for tourniquet use include uncontrolled extremity hemorrhage, limb amputation, or a mangled limb that has multiple bleeding areas. Some examples where tourniquets might need to be used involve penetrating trauma from gunshot wounds or stabbings, wounds associated with blast injuries, machinery accidents in the industrial or farm setting, and remote emergency medical situations in an austere or wilderness environment. There are two main contraindications when using a tourniquet. One, never apply a tourniquet on a joint. A tourniquet over a joint is not conducive to compression of blood vessels. The tourniquet may also loosen with flexion and extension of the joint. Two, applying a tourniquet or a BP cuff to an extremity with a dialysis fistula to control bleeding many times will clot off the graft. Therefore, direct pressure is suggested as initial treatment. There are three main parts of the tourniquet: the strap, which wraps around the limb to apply pressure; the windlass, which is a rigid device used to twist the strap and tighten the tourniquet to stop bleeding; and a securing device, which secures the windlass to prevent unwinding. Here are three examples of different tourniquets: CAT, or Combat Application Tourniquet; MAT, or Mechanical Advantage Tourniquet; and the SOF, or Special Operation Forces Tourniquet. The current tourniquet of choice for the military and many police departments is the CAT tourniquet, but the choice of tourniquet to carry and use should be discussed with your agency medical director. Today, we will be using and displaying the CAT tourniquet. Watch now as a rescuer applies a CAT tourniquet to an upper extremity with a life-threatening hemorrhage. Try and find the source of bleeding and place the tourniquet around the wounded extremity. Ideally, this should be placed 2 inches above the wound. Place the free end of the tourniquet through the slot on the buckle that is closest to the strap and pull the strap tight and adhere it back onto itself. Do not go past the windlass clip. Now twist the windlass rod until the bright red bleeding has stopped. Then lock the rod in place by using the windlass clip. Now bring the self-adhering band past the windlass clip and over the rod. Take the windlass strap and secure it to the windlass clip and record the time of tourniquet application. In review, remember, when faced with a life-threatening extremity hemorrhage, you must first try and locate the source of bleeding. Then place the tourniquet 2 inches above the wound. Turn the windlass until bleeding has stopped. Make sure to secure the windlass rod. Record the time of application of the tourniquet. Watch again as a rescuer applies a CAT tourniquet to a lower extremity with a life-threatening hemorrhage. Try to find the source of bleeding and place the tourniquet around the wounded extremity. Ideally, this should be placed 2 inches above the wound. Make sure to use both slots of the buckle when applying to a lower extremity. Once the strap is through the buckle, adhere the strap onto itself. Then twist the windlass rod until bleeding has stopped. Lock the rod in place by using the windlass clip. Now take the windlass strap and secure it to the windlass clip. Record the time of tourniquet application. The patient is now ready for transport. There may be times when a field expedient tourniquet will need to be used. You may be in a situation where no commercial tourniquet is available, or you may be involved in a scene where multiple tourniquets are needed. To make a field expedient tourniquet, you will need a strap, a windlass, and a securing device. A strap may be any type of flexible material that is at least 1 inch wide and long enough to wrap around an extremity. Examples of what can be used as a strap are belts, triangular bandage, roll of gauze, a pant leg or other strip of clothing, or a section of a seat belt. A windlass is a solid object that can be used to twist and tighten the tourniquet. Examples of what might be used as a windlass include a stick or piece of wood, a flashlight, lug wrench, tubing, or pipe. A securing device will be anything that will prevent the windlass from unwinding. Examples of this include gauze, duct tape, triangular bandage, straps, or webbing. This is an example of a field expedient tourniquet. Notice that the strap being used is a piece of garden hose. The windlass is a piece of aluminum tubing, and the windlass is being secured by gauze. In this demonstration of a field expedient tourniquet, we will use a triangular bandage or a cravat as our strap. Once we have located the source of bleeding, place the material 2 inches above the wound and then tie the knot as tight as you can. Next, we will place our windlass, in this case a stick, over the bandage, then take your cravat and tie another knot over the windlass. Then twist the windlass until bleeding has stopped. Now we will secure the windlass. Today we will be using a roll of gauze. Wrap the gauze around the windlass and the leg, securing the windlass in place. Remember to record the time of application. As an alternative to the securing device, you may be able to use the strap to secure the windlass. Simply wrap the material around one end of the windlass and back around the extremity, and then tie one more knot in the strap, therefore securing the windlass in place. There are some things we need to consider when using a tourniquet. 1. When in an environment that requires rapid placement of a tourniquet, it is okay to place the tourniquet over top clothing. When placement of the tourniquet is over top clothing, placement should be as close to the torso as possible. 2. Placement of the tourniquet should not exceed 2 hours. If application is going to exceed 2 hours, medical control should be contacted. 3. With any change in the status of the patient or with movement of the patient, the EMT should reevaluate the tourniquet. Make sure the windlass is well secured and bleeding has not restarted. 4. Patient receiving a tourniquet should be transported to the appropriate destination following regional trauma protocols. 5. The tourniquet application should be reported to the receiving facility. And lastly, once the tourniquet is placed on the patient, it should not be removed in the field.